Anxiety is a normal emotion, a phenomenon that is triggered as a reaction to stress. In many cases, it is actually helpful and it helps us by alerting us to a dangerous situation and makes us prepare for it. For example, stress related to an approaching exam can actually be a driving force that will help us prepare for it. Imagine preparing for an exam where you have no worry about it whatsoever. It can actually end up being problematic instead. But when we talk about anxiety disorders, the fear or anxiety in response to a real or imagined situation is so severe and excessive that sometimes it happens even without a threatful situation itself. Think of it like a fire alarm bell that has gone awry, that not only begins to ring without any smoke or fire, but is also too loud and takes too long to turn off. That is something that will explain an anxiety disorder. It is the most common kind of a mental illness and affects nearly third of a general population. Different kind of mental illnesses with respect to anxiety disorders include social anxiety disorder, where the feelings of extreme anxiety are triggered in social situations like talking in public or during interviews or meetings. Panic disorder, where sudden and recurrent panic attacks occur unexpectedly and cause significant disturbance in daily functioning. Generalized anxiety disorder, where feelings of excessive worry occur regarding even normal day-to-day events, activities, and situations. A major consequence of anxiety disorder occurs where individuals begin to avoid situations that trigger or worsen their symptoms. It can happen while traveling, using elevators, crowded places such as malls, railway stations, temples, mosques, exercising, public speaking, meetings. It can happen anywhere. As a result, job performances, school work, personal relationships get affected. Individuals lose out on opportunities or can end up performing poorly in these situations, leading to anxiety. And due to this anxiety, it further worsens their situation, creating a vicious cycle. Coming to the cause of the anxiety disorder, while there is no specific single cause, contributing factors include genetic influences, the kind of upbringing that the child gets. Sometimes when the child is very overprotected and shielded from the outer world, the limitation of exposure of a child during his growth, and also our personality and our nature as well. Apart from this, alcohol and tobacco use, thyroid problems, and certain medications can also trigger anxiety disorder. Coming to the treatment, milder forms of anxiety, which virtually all of us have at some point or other in life, can be managed using meditation, deep breathing exercises, mindfulness, relaxation techniques. However, more severe and recurrent debilitating forms of anxiety may require medications and therapy. The therapy in such a case specifically targets the distorted thought processes regarding the physical symptoms of anxiety and trains a person to deal with these situations and manage the anxiety that comes secondary to it without resorting to avoiding or escaping them. With a combination of these, the disorder can be completely brought under control in most cases.